This midday, we are talking about a very important disorder, not a disorder, but a women's health issue that many people suffer from in silence: pelvic floor dysfunction. Dr. Mike Scolieri, did I say it right?
Scolieri, yes.
Scolieri is here to talk to us about something called PVD, or pelvic floor dysfunction. Thanks so much for joining us, doctor. So first, we all want to know, what is PVD?
Pelvic floor dysfunction is a myriad of symptoms and conditions that are caused by abnormalities of the muscle or the neurologic system of the pelvic floor, and it can lead to a lot of problems for patients, women specifically. 1 out of 4 women actually have bothersome symptoms from pelvic floor dysfunction, and unfortunately, the majority of these women don't seek help because they're misled to believe that this is just a normal part of aging or having children, and so they tend to just cope with these things rather than pursue treatment.
So what are some symptoms? What should we be looking for?
Well, there's a lot of symptoms with pelvic floor dysfunction. Most commonly we see incontinence, or the involuntary loss of urine. That can be stress incontinence, where a person leaks when they cough or sneeze or perform some activity. Urge incontinence is incontinence that's preceded by this severe urge to get to the bathroom. We also see patients with bowel dysfunction, and this is one of the more significant ones: accidental bowel leakage. 18 million Americans have accidental bowel leakage, and 86% of them don't present to their physician to discuss it. So these patients are the ones that live at home and are prisoners to the bathroom or prisoners to their pads and diapers. So, and then one of the other conditions we see is pelvic pain, or bladder pain, or even pain with intimacy. So there's a myriad of symptoms, but they're all classified under pelvic floor dysfunction.
So what are some of the treatment options if you're having these issues?
After a patient has an evaluation, we oftentimes treat them, most often, with non-operative treatment. And that is treatment option known as pelvic floor muscle therapy. So we use guidelines from the American Urological Association, the Society of Female Urology, and even the American College of Gastroenterologists, and we've developed care paths. And in every care path, the first line therapy is treatment of the pelvic floor musculature with just simple things that we do in the office, with a treatment that occurs 30 minutes a week for about 4 to 6 weeks. If patients don't do well or aren't satisfied with the results, then we move down the care path, and it depends on what treatment or what symptom complex they have.
Okay.
But other treatments are offered to them. The one thing people do fear is major surgery.
Yes.
And for any of these disorders, none of the surgeries are major. All of the surgeries are minimally invasive, less than 20 minutes. So patients start off with a non-invasive, very simple treatment option, and that may treat the majority of patients. Medications are part of the treatments, and then possibly a minimally invasive procedure at the end.
So I hear that you're having a great event for Valentine's Day, where we can, come into your office and get a little checkup.
Right. So what we're asking is women to, on Valentine's Day, be their own Valentine.
Yes.
And if they're suffering from these conditions, rather than not being treated or being ignored, they can come in and talk to us. They fill out a questionnaire, and then either I or my nurse practitioner will meet with them alone in a room and just kind of go over briefly what options are available to them. The patients are given literature to go home with, and then they're empowered to decide whether they want to pursue treatment or not, but they don't have to live with these symptoms, and that's what they're doing now. So we get that a lot of times. Patients are like, "Where were you 15 years ago? I've been here,
yes,
but you haven't got to me." So that's the message.
So you have to tell us, how can we get to you? Give us that address and the time of. Is this going to take place all day on Valentine's Day?
It's going to take place all day. It's going to be at our office in Canfield, 3660 Stutz Drive, Suite 202, and we'll be there from 9 to 4. Patients do not have to make an appointment. They can just come in, and the whole process may take 15, 20 minutes, but hopefully we can help a lot of people. We did it last year. We had dozens of people come in, and many people were helped.
Excellent. Thank you so much for joining us.
Thank you for having me. Thank you for letting me give this message out.
Absolutely. Great information.